Good day everyone. As we go into another eating disorder, let me introduce myself first. I am Jaida Dumato de Salongan, your last reporter for this topic. Sa bulimia nervosa. Bulimia nervosa is an eating disorder. It is characterized by uncontrolled episodes of overeating called binging. This followed by purging by self-induced vomiting, misuse of laxatives, and other methods. Bulimia typically affects females and starting during the teenage years, but it can also affect males. So guys, ang bulimia nervosa ay isa ring eating disorder na nagko-cause ng massive intake of foods but with different diagnostic criteria. Also based on the US epidemiological studies, it most likely present on females, but then I'll explain more of that later. So ang bulimia nervosa ay isang malubhang kondisyon na pangkalusugan sa pag-iisip na kumakatawan sa pagkakaroon ng paulit-ulit na pagkain ng labis-labis, na sinusundan ng mga hakbang upang maiwasan ang pagtaas ng timbang tulad ng pagtatae, sobrang ehersisyo o paggamit ng laxatives o diuretics. So how would we determine if someone has a bulimia nervosa? So let's check out sa diagnostic criteria nito. So, criterion A, recurrent episodes of binge eating. An episodes of binge eating is characterized by both of the following. So, number 1, eating in discrete period of time within any 2 hours period, an amount of food that is definitely larger than what most individuals would eat in a similar period of time under similar circumstances. Number 2, a sense of lack of control over eating during the episode, feeling that one cannot stop eating or control what or how much one is eating. So under the criterion A, as what I have said earlier, bulimia nervosa cause massive intake of foods, and based on the criterion given, ang taong merong ganitong disorder are those people who eats from time to time. So ipinapagkahulugan nito bilang pagkain ng sobra-sobra ng daming pagkain sa loob ng maikling panahon, kasama ang pakiramdam ng kawalan ng kontrol sa pagkain ng isang upuan lang. Criterion B, recurrent inappropriate compensatory behaviors in order to prevent weight gain, such as self-induced vomiting, misuse of laxatives, diuretics, or other medication, fasting, or excessive exercise. So paulit-ulit, hindi angkop ang mga hakbang para mapanatili o mapababa ang timbang. Ito ay maaaring magiging pagtatae, paggamit ng laxative, diuretics, pagpa-fasting o sobrang ehersisyo. Ginagamit ang mga ito upang upang mabawasan ng epekto ng binge eating at maiwasan ng pagtaas ng timbang. So basically guys, while they are eating too much, they are also forcing themselves to lose weight in terms of ways of which leading to more complicated things. And then, sa criterion C, the binge eating and inappropriate compensatory behaviors both occur on average at least once a week for 3 months. Ang binge eating ay isang kondisyon kung saan ang isang tao ay kumakain ng labis-labis at hindi maayos o kontrolado. Ito ay nagaganap sa loob ng maikling panahon, kadalasan sa loob ng 2 oras o mas kaunti. Ang individual ay kumakain ng malaki o maraming pagkain kaysa sa karapatang kinakain ng karamihan ng mga tao sa parehong panahon at sitwasyon. So under criterion C, ang binge eating at hindi angkop sa mga hakbang para mapanatili o mapababa ang timbang ay ginagawa ng isang taong may bulimia nervosa. Hindi bababa sa isang beses kada linggo sa loob ng 3 buwan. Criterion D, self-evaluation under the influence by body shape and weight. Criterion C, the disturbance that not occur exclusively during episodes of anorexia nervosa. So, in partial remission after full criteria for bulimia nervosa were previously met, some but not all of the criteria have been met for sustained period of time. In full remission after full criteria for bulimia nervosa are previously met, none of the criteria have been met for sustained period of time. So, how are we going to determine if a person has a mild, moderate, severe, or an extreme level of bulimia nervosa? The specified current severity, the minimum level of severity, is based on the frequency of inappropriate compensatory behavior. The level of the severity may be increased to reflect of other symptoms and the degree of functional disability. So, mild, an average of 1 to 3 episodes of inappropriate compensatory behaviors per week, no? So, moderate, an average of 4 to 7 episodes of inappropriate compensatory behaviors per week. Severe, an average of 18 to 13 episodes of inappropriate compensatory behaviors per week. Extreme, an average of 14 or more episodes of inappropriate compensatory behaviors per week. Diagnostic feature. There are three essential features of bulimia nervosa: recurrent episodes of binge eating, urgency, recurrent inappropriate compensatory behaviors to prevent weight gain, criterion D, and self-evaluation that is under influenced by body shape and weight gain, criterion D. To qualify for the diagnosis, the binge eating inappropriate compensatory behavior must occur on average at least once per week for 3 months, no, sa criterion C. So, an associated feature, no? So, guys, people with bulimia nervosa are those usually in a normal weight or overweight in normal, no? It is because of their massive intake of foods at the same time ang kanilang crucial diet. Also, they are in a regular menstruation simply because of unhealthy balanced diet plus the emotional distress na naidudulot ng kanilang sakit. So, in prevalence naman, na basically pinapakita ng studies na ito na based on the studies of females are prone to bulimia nervosa. We are more prone to eating a lot at the same time being body conscious. So, development and course, no? Karaniwan ng bulimia nervosa ay maaaring magsimula noong pagkabata o kabataan, no? Ngunit ito ay maaari ring mangyari sa unang yugto ng buhay. Ang mga tao na may predisposition sa karamdaman sa pagkain, kawalan ng kumpiyansa o stress ay may mas mataas na panganib na ma-develop ito, no? Sa mga unang yugto, maaaring magkaroon ng mga episode na sobrang pagkain kung saan kumakain na ng malakas ang isang individual sa loob ng maikling panahon, no? Matapos ang binge eating episodes. So, nagkakaroon ng mga hakbang na pampapayat upang maapaalis ang mga kinain na kalorya, no? Ito ay maaring sa pagsusuka, paggamit ng laxatives, pag-inom ng maraming tubig o pag-ehersisyo ng sobra-sobra. Ang mga binge eating episodes ay nauulit at sumusunod pa rin sa compensatory behaviors. Ito ay nagdudulot ng malubhang stress at emotional na labis-labis na pag-aalala. Rest and prognostic factors, no? Temperamental, no? Weight concerns, low self-esteem, depressive symptoms, and social anxiety disorder, and a sheltered generalized anxiety disorder associated with increased risk for the developmental of bulimia nervosa, no? Ang kawalan ng kumpiyansa sa sarili o ang hindi pagkakaroon ng positibong pagtingin sa sariling katawan ay maaaring magdulot ng bulimia nervosa. No, environmental, international of a teen body ideal has been found to increase the risk for developing weight concerns, which in turn increase risk for the development of bulimia nervosa. So, individuals who experience childhood sexual or physical abuse are at increased risk for developing bulimia nervosa. So, ang mga taong karanasang sexual abuse ay prone sa bulimia nervosa. Genetic and psychological, no? Kung may kasaysayan ng karamdaman sa pagkain o mga problemang sa kaisipang pamilya, no, maaaring magdulot ito ng mas mataas na panganib. No, course modifiers, no? Kung may kasabayan na iba pang mga karamdaman tulad ng depression o anxiety, ito ay maaaring makaapekto sa prognosis ng bulimia nervosa dahil mananatili ito sa matagal na panahon. Sa culture-related diagnostic issues and sex and gender-related diagnostic issues, ang pagiging prone ng mga kababaihan sa bulimia nervosa is not yet been systematically examined. But then, based on the data gathered, it was clearly proven that females are the usual people who has bulimia nervosa. Association with suicidal thoughts or behavior na so with all the stress and episodes na nararanasan ng tao may bulimia, they are the people who also suffers from suicidal thoughts simply because of their pinagdadaanan that making them think or plan of killing themselves. So, differential diagnosis and comorbidity, no? As you can see, there are another diagnosis naglead if hindi na-reach ang buong diagnostic disorder ng bulimia nervosa. It can be anorexia nervosa, binge eating disorder, Klein-Levin syndrome, major depressive disorder, borderline personality disorder. But then, I will not explain this all one by one because itatakal din ito or yung iba ay na-discuss na rin from different reporters, no? So, let's now proceed to other eating disorder under my report. Binge eating disorder, no? Ang binge eating disorder o BED ay isang karamdaman sa pagkain kung saan ang isang individual ay nangangarap ng malalakas na binge eating episode sa bed, no? Ang isang tao ay naglalantakan ng malalaking halagang pagkain sa loob ng maikli at particular na panahon. Ito ay karaniwang naukit sa kakulangan sa kontrolado sa pagkain at sa labis na pagkain. The diagnostic criteria, no, are recurrent episodes of binge eating and episodes of binge eating is characterized by both of the following, no. Number 1, eating in discrete period of time within 2-hour period an amount of food that is definitely larger than what most people would eat in a similar period of time under similar circumstances. Number 2, a sense of lack of control over eating during the episode, no, feeling that one cannot stop eating or control what or how much one is eating, no. So, sa bed, no, ang isang individual ay naglalantakan ng malalaking halaga ng pagkain sa loob ng maikli at particular na panahon. Ito ay mas malalakas kaysa sa karaniwang pagkain ng tao. At karaniwan ay mayroong kakaibang uri ng mga pagkain na kinakain at wala silang kontrol sa kung anong kakainin nila. So, the criterion B, no, the binge eating episodes are associated with 3 or more of the following. Number 1, eating much more rapidly than normal. Number 2, eating until feeling uncomfortably full. Number 3, eating large amount of food when not feeling physically hungry. 4, eating alone because of feeling embarrassed by how much one is eating. Feeling disgusted with oneself, depressed, or very guilty afterward, no? So, sorry guys, but I think na-miss ko yung C and D na slides, but then I'll explain it na lang, no? So, criterion C, mark the stress regarding binge eating is present. Criterion C, the binge eating occurs on average at least once a week for 3 months, no? So, ang BED ay naukit sa pamamagitan ng pagkakaroon ng hindi bababa sa isa o higit pang binge eating episode sa isang linggo sa loob ng 3 buwan. Criterion E, the binge eating is not associated with the recurrent use of inappropriate compensatory behavior as in a bulimia nervosa and does not occur exclusively during the course of bulimia nervosa or anorexia nervosa. So, in partial remission, no, after full criteria for binge eating disorder were previously met, binge eating occurs at an average frequency of less than 1 side episodes per week for a sustained period of time. If a person meet the diagnostic criteria and undergo the treatment in partial remission, dapat malisin na ng episode ng isang tao ang binge eating disorder. And full remission after full criteria of binge eating disorder were previously met, none of the criteria have been met for sustained a period of time, no? And for remission of treatment, hindi na mag-o-occur yung diagnostic criteria ng isang individual. So, how are we going to determine if a person has a mild, moderate, severe, or extreme level of binge eating disorder? As physical current severity, the minimum level of severity is based on the frequency of episodes of binge eating No, the level of severity may be increased to reflect other symptoms and degree of functional disability. So sa mild, 1 to 3 binge eating is episodes per week, 4 to 7 binge eating episodes per week sa moderate, severe 8 to 13 binge eating episodes per week, extreme 14 or more binge eating episodes per week. So, diagnostic feature, the essential feature of binge eating disorder is recurrent episodes of binge eating that must occur on average at least once per week for 3 months, no? And episodes of binge eating is defined as eating a discrete period of time and an amount of food that is definitely larger than most people would eat in a similar period of time under similar circumstances, criterion A1. Ayun nga, under criterion, yung taong may binge eating disorder ay ang kumakain ng sobra-sobra, no? So, a single episodes of binge eating need not be restricted to one setting. For example, no, an individual may begin in binge eating in restaurant and then continue to eat on returning home, no? Continual, no, snacking on small amounts of food throughout the day would not be considered an eating binge. No? Guys, take note that hindi porket kumakain ng snacks, no, ng sunod-sunod is ng isang araw is feel mo may binge order ka na. It's not like that, no? And ang occurrence of excessive food, no, consumption must be accompanied by a sense of lack of control, no, sa criterion A2. No, to be considered an episodes of binge eating, an indicator of loss of control is the inability to refrain from eating or to stop eating once started, no. Basically, it has to be lack of control sa pagkain, and when we say lack of control, as what I have explained kanina sa criterion 2, it means hindi mo nakokontrol ang pag-take mo ng pagkain. So, madalas ang taong may binge eating, no, ang disorder ay mostly overweight, no, but not necessarily, kasi ang iba naman yung diagnostic feature nun and yung causes niya. But then people with binge eating disorder are overweight. So, guys, sa prevalence, no, so based on the study itself, woman has the higher percentage of having the binge eating disorder, pero the reason behind that is not yet determined. So sa developmental course, no, ang binge eating disorder or BED ay isang seryosong kalagayan sa mental na kinasasangkutan ng paulit-ulit na pagkakaroon ng epidesyong malalaking pagkain sa loob ng maikling panahon na may kasamang pakiramdam ng pagkawalang kontrol sa isang pagkakataon na ito. So, karaniwang meron din kasamang damdaming pagkukulang, hiya at kalituhan ng mga pagkakataong ito, no? Ang BED ay maaaring magdulot ng malalim na epekto sa pisikal na kalusugan, emosyonal na kalagayan at kalidad ng buhay, at madalas na natatamaan nito ay yung mga adolescents. Rest and prognostic factors, no? Basically, ang binge eating disorder runs in the family. It can pass through genes. And cultural related diagnosis issues, no, based on DSM-5, no, when it comes to cultural basis, no, mas larger scale ang black people na may binge eating disorder rather than the white people. So, association with suicidal thoughts or behavior, no, 25% of people na may binge eating disorder ang merong ideation of suicide or ang nagkakaroon ng suicidal thoughts because of their conditions. So, differential diagnosis, no? So, guys, there's a lot of eating disorder na may we encounter, and pag may isa lang sa diagnostic criteria and di na-reach, it can lead to other disorders such as in differential diagnosis, no? So, ilan lang yan sa mga susunod na slides, but I will not explain it further because it can be explained by the different reporters, or we had tackled about it already. Bulimia nervosa, na binge eating disorder has recurrent binge eating in common with the bulimia nervosa but differs from the latter disorder in some fundamental respect. In terms of clinical presentation, the recurrent inappropriate compulsive behavior, purging, driving, exercise seen in bulimia nervosa is absent binge eating disorder, unlike individuals with bulimia nervosa. Individuals with binge eating disorder typically do not show marked or sustained dietary restriction designed to influence body weight and shape between binge eating episodes. Obesity. Binge eating disorder is associated with overweight and obesity but has several key features that are distinct from obesity. First, levels of overvaluation of body weight and the shape or higher obese individuals with the disorder than in those without the disorder. Second, rates of psychiatric comorbidity are significantly highest among obese individuals with the disorder compared with those without the disorder. Third, the outcome of evidence-based psychological treatments for binge eating disorder is more often successful than the treatment of obesity in the individuals with comorbid obesity and binge eating disorder. Bipolar and depressive disorder, increases in appetite and weight gain are included in the criteria for major depressive episodes and in the atypical features specifiers for depressive and bipolar disorder. Increased eating in the context of major depressive episodes may or may not be associated with loss of control in the full criteria for both disorder are met. Both diagnosis can be given. Borderline personality disorder, binge eating is included in the impulsive behavior criterion that is part of the definition of borderline personality disorder. In the full criteria for both disorder are met, both diagnosis should be given. Ang comorbidity, ang binge eating disorder ay linked sa bulimia nervosa and anorexia nervosa. If you're listening to the previous reports, and topics, it is indeed similar but has different diagnosis. Going on well, now proceed to other type of eating disorder, the other specified feeding or eating disorder. This category applies to presentation in which symptoms characteristic of a feeding and disorder that cause clinically significant distress or impairment in social, occupational, or other important areas of functioning predominate but not meet the full criteria for any of the disorder in the feeding and eating disorder. So this disorder has the specific criteria of some eating disorder, but it didn't reach at all. So number 1, atypical anorexia nervosa. All of the criteria for anorexia nervosa are met except that despite significant weight loss, the individual's weight is within or above the normal range. Individuals with atypical anorexia nervosa may experience many of the psychological complications associated with anorexia nervosa. So, atypical anorexia nervosa is like anorexia nervosa, but the difference is that it is in normal range, or weight, unlike the anorexia nervosa na under sa weight niya. So, number 2, bulimia nervosa of low frequency and or limited duration. All of the criteria for bulimia nervosa are met except that the binge eating and inappropriate compensatory behaviors occur on average less than once a week or for less than 3 months, Dito naman, it's like the bulimia nervosa lang, but the thing is, it didn't reach the 3 months presence of episodes, number 3, binge eating disorder of low frequency and or limited duration. So number 4, purging disorder. Recurrent purging behavior to influence weight or shape, self-induced vomiting, misuse of laxative, diuretics, or other medication. In the absence of binge eating, so in this side is yung normal na pagkain, but it is so obsessed on body figures without. Number 5, night eating syndrome. Recurrent episodes of night eating as manifested by eating after awakening from sleep or by excessive food consumption after the evening meal. There is awareness and recall of the eating. The night eating is not better explained by external influence such as changes in the individual's sleep-awake cycle or by local social norms. The night eating causes significant distress and or impairment in functioning. This night eating disorder is a serious matter of taking foods at night when you wake up. It's like you cannot control yourself from taking foods when you awake at night without any reason or even though you all already had your dinner. So, unspecified feeding or eating disorder, no, when we see unspecified eating disorder, ito yung di ma-determine kung anong type of eating disorder na tinitake nila, no? Simply because hindi sinasabing patient yung whole details or their symptoms or the patient itself. It is denial. So, that's all for my report. I hope you learn a lot. Thank you.